Hi, welcome to Checking In with Amy. My name is Amy Goldberg. I'm a registered nurse with the Elder Service Plan of the East Boston Neighborhood Health Center. We take care of people who are 55 years of age and older who live in the communities of East Boston, Chelsea, Revere, Winthrop, and Everett. And the goal of our program is to keep people living in their homes independently in a healthy, active manner. We've had various shows. I hope you've seen some of them. One on healthy eating for older adults, another one on dementia, and still another on the role of the nurse practitioner. Today, I'm delighted to have two guests with me that are both psychiatric clinical nurse specialists. They are Linda Kasparian and Ian LaRose. So let's welcome them, and let me start by saying hello, welcome.
Hello, thank you.
Linda, welcome to Checking In with Amy, and could you tell me a little bit about yourself?
Okay, so I'm a psychiatric clinical nurse specialist. I've been working with the Elder Service Plan for the last 2 years, although I have been working in mental health for the last 30 years. And actually, to be exact, it's 36 years.
Wow, it's a long time.
It's a long time. Of those 36 years, 20 of those years I've devoted to working with older adults, and that's really been the area of interest for me from almost the very beginning when I was in graduate school. So I'm originally from New York. I earned a bachelor's degree in nursing from Downstate Medical Center in Brooklyn. I did move to Boston at some point, and eventually moved back to New York to attend graduate school at Columbia University, where I earned a master's degree in psychiatric community mental health nursing. And I worked in both Boston and New York. In New York, I worked in many of the major city hospitals like Bellevue, Harlem Hospital, Metropolitan Hospital Center. So.
Not easy.
Right. They were good places to train.
That's right. And
good
Ian,
experiences.
a little bit about you too?
Sure. Well, my background's similar to Linda's. I've been practicing for over 10 years now, and I've been at the East Boston Neighborhood Health Center for about 4.5 years, during which time I've focused mostly on older adults and adults with complex medical problems.
Well, I'm excited to have you both here. You're a great team. So now, you both said to me, we're psychiatric clinical nurse specialist. It's a hard thing to say, but what exactly is that?
Mm-hmm. Well, that's a good question. A psychiatric clinical nurse specialist is an advanced practice nurse. I think to a patient, in a lot of ways, it may look very similar to a nurse practitioner. And we have a master's degree in nursing, like a nurse practitioner does. We're also board certified in our area of specialty, which is adult mental health, and that means that we can take care of adults with anxiety, depression, memory problems, substance abuse, things of that nature.
That's good. Now, Linda.
And as advanced practice nurses, we also have prescription writing privileges.
That's right.
That's right. We diagnose and prescribe. And
I didn't know that when we first met, so I asked you that exact question. I thought that was kind of interesting. So now, tell me what, I think people have misconceptions about this role. So if you could just explain to me what you are and what you are not, that might help the listening audience.
Okay, so we are nurses, advanced practice nurses, as Ian said, and practicing in an expanded role. We did want to emphasize, that we are not psychoanalysts. We're not, we do not do psychoanalysis. We do not have couches in our office. We have normal offices. We are not psychologists, we're not psychiatrists. And the reason that I thought it was important to sort of emphasize, what we actually do and what we don't is that recently I had an experience with one of the participants who was originally referred to me back in October of 2014, and I didn't actually see her for evaluation until April of 2015. So almost 6 months had elapsed.
Wow.
And when I finally saw her and I asked her and inquired with her, you know, what took so long between the time of referral and evaluation, she explained to me that she had been quite anxious about the appointment, that she kept canceling the appointment, and that her anxiety and fear was that I was going to psychoanalyze her, or that she was going to have to disclose things about her childhood or dredge up things that
Right.
she did not feel comfortable sharing. And of course, that was not the case at all. She felt very comfortable with the experience. She found it to be very supportive and helpful, and had regretted that she waited as long as she had before coming, and was actually grateful that she did come for the appointment.
And that's what
And
I
is
see with a
scheduled
lot of
for
it. Yeah.
another other appointments
Right.
with me. So.
And that's what I see a lot of the time, that people are like so grateful that someone would really listen to their issues and not judge. And it's wonderful. Now, I think the next question would be about your approach to care. So everyone has different approaches, and I think it would be helpful for you to explain to us your approach.
Sure, that's a good question. We use a biopsychosocial approach. So what is that? Well, when we talk about a biopsychosocial approach to symptom management or to any aspect of healthcare, it's really just another way of saying that instead of simply looking for medical causes and medical treatments for problems, we really try to look at the whole person.
Right.
Specifically, that does include looking at medical or biological issues. That's the bio part of biopsychosocial. And that could include anything from pain to diabetes or thyroid problem. And then beyond that, we also consider what people are thinking and feeling and how that may affect their health and well-being. That's the psych part. And finally, we consider the person's environment and social situation.
That's clear. So it's a three-part approach. So now we have all this help available, but people don't all come. So what do you think are the major barriers that we could just touch on, just briefly, about each barrier that you think is out there?
Okay, so one of them is access. Oftentimes there is limited availability of mental health services, long waits for mental health services. Also, particularly with older adults, there are not that many people who have the level of expertise, who have made that area practice, their specialty area.
Right.
So that would be one barrier. And there's also many assumptions and myths about mental health treatment. And it can be either on the part of the referring physician or the patient, just like we were talking about, this. Sometimes people have this idea that older adults are too old to benefit from any kind of mental health treatment. And then there's this assumption that depression, things like anxiety and depression are normal.
Right.
It's expected. It's a normal course of aging. People have multiple medical problems and have had multiple losses. Why wouldn't they be depressed?
Right.
But we don't think it's normal. It isn't normal. Does not have to be associated with aging, and we do think that people can receive help. And then cost and insurance is another issue, not an issue for us. Mental
Right.
health services are covered. There's no limit on the number of visits that people can have. And finally, for me, and we'll talk about some other barriers, there is the continued problem even today of embarrassment, shame, stigma around mental health care. this idea that only crazy people see mental health practitioners, and then many older adults are of a generation where they did not seek out treatment. People kind of pulled themselves up by their bootstraps,
Right.
or didn't feel comfortable disclosing personal information to someone else. So it just wasn't something that people did. And we just thought it might be important to just emphasize that there are many people who suffer from depression and things like that. Winston Churchill, Princess Diana, Marlon Brando, Buzz Aldrin,
Wow.
the astronaut. So it's not an uncommon thing.
Right, right. This is really helpful. So people can identify with, they're not the only ones.
Right. Well, just to add to Linda's list of barriers that can keep people from seeking the help that they may need, a few other things that come to mind: lack of integration with primary care. Any specialist that you see should understand your medical history, I think. Medical problems could be another barrier. Certain medical conditions can keep people at home, or even contribute to or complicate other symptoms that they may be having. Privacy concerns. Do I really want to share my story with this person? Where will that information go? That's an important question. And then transportation, I think, can be a barrier for some people too. Finding a specialist and making an appointment is one thing, but not everybody can easily get to and from appointments.
That's right.
Yeah.
So thank you. That's a lot of barriers. I think one of the main topics today that I would love to bring to everyone's attention is the issue around stress. We all have stress. Every time we think about different things, we could get very stressed. So there's good stress, I know, and then there's not so good stress. So do you want to talk a little bit about that?
Sure. So when we think of stress, we usually think about it in a very negative way, but there's also, there is good stress. It's been said, that the absence of stress is death. So we need stress to get us up, to get us going,
Right.
to get us mobilized. It got us mobilized, be here to check in with you today.
Yeah.
So, stress is important for all of us, and it can also be life-saving. It was a primitive survival mechanism designed for early life, so when we were hunters and gatherers, when there was real danger, it was a way of getting us out of danger quickly. And that's called the fight or flight response, which people are probably familiar with.
Right.
But it's meant to be both, it's meant to be turned on and then off, and all of us have trouble turning it off. So it's the long-term effect of stress that the long-term activation of the stress response that's associated with
Right.
physical illness and medical, chronic problems.
Right.
And I think the best way for us to understand the stress is to watch this video that you both came up with, which to me it's the best I've ever seen. So let's take a few minutes and watch this video, and then we'll come right back.
Welcome to our segment on the long-term effects of stress. Many of us lead stressful lives and feel the effects of stress every single day. Over time, we put excess strain on our bodies, and consistent stress can plant seeds in our body that can lead to very serious long-term illness. When life stressors are constant, our stress response, our fight or flight response, stays activated and puts excess strain on our physiology and can do some really serious damage to our bodies. It's no surprise that we hear more and more about people suffering from heart disease, stroke, cancer, diabetes, and more. Let's take a look now how consistent stress on our bodies over time contributes to these serious illnesses. Increased heart stress and blood pressure In our last segment, we learned that each time you are stressed, you put excess strain on your heart and your blood pressure increases. This stress on your heart and circulatory system over time can lead to heart attacks and coronary heart disease. The American Heart Association states that 1 American dies every 40 seconds from cardiovascular disease. Increased blood clotting. Under stress, your blood clots, preventing the free flow of blood throughout your body. When you're stressed over time, the increases in clotting and sticky platelets in your blood can also lead to heart attacks and strokes. According to the American Heart Association, strokes account for 1 of every 19 deaths in the United States. Decreased immunity. Under stress, your immune system is suppressed. Over time, consistent activation of this stress response and reduction in your immunity can lead to cancer, infections, and other serious diseases. At the time of this video, the American Cancer Society website currently estimates that 1 out of every 2 men are at risk for developing cancer in their lifetime. The risk for women is 1 out of 3. Suppressed digestion. If you are consistently stressed, your digestive system can be suppressed. Over time, this can lead to weight gain, digestive disturbances, and even obesity. The American Heart Association estimates that 154.7 million adults are overweight or obese in the United States, and 23.9 million children ages 2 to 19 are also overweight or obese. The American Gastroenterological Association estimates that a whopping 33% of people in the United States have acid reflux disease. Increases in blood sugar. Stress increases the blood sugar throughout our bodies. Over time, these increases in your blood sugar levels can lead to diabetes, obesity, kidney failure, nerve damage, and even vision problems. The American Diabetes Association estimates that 25.8 million children and adults in the United States have diabetes. That's 8.3% of our entire population. Decreases in anti-aging growth hormones. Over time, if you are stressed regularly, your body continues to reduce the flow of anti-aging growth hormones. And there are many studies that show that the reduction of these growth hormones can lead to premature aging. So, under stress, you age faster. Increases in stress hormones. Regular activation of our stress response floods our bodies with stress hormones, adrenaline, noradrenaline, and cortisol, just to name a few. Over time, this can lead to anxiety, insomnia, serious memory and concentration impairment, osteoporosis, addictions, and even depression. Studies indicate that high cortisol levels over your lifetime have been found to lead to Alzheimer's disease and even senile dementia.
So I hope you enjoyed that. I learned an awful lot from that video. I hope you did, especially about the digestion. I never knew that even was an issue. So now we know what causes stress. We know all of that. So now how are we going to deal with it? I mean, that's the hardest thing, I think, for people today is dealing with stress. So if you could give us a few helpful hints on that, that would be a great help for our audience.
Sure. I think there are several things that people could think about every day that might help to reduce stress or improve our ability to cope with stressful things as they come up. A few of them will just take a break sometimes. Laugh or smile. I think a sense of humor is very important for coping with stress. Eating healthy is something that we often hear about, and it can be helpful for stress as well. Exercise, setting realistic goals, getting enough sleep, staying connected with friends and families, and I would add to that to healthcare providers, getting organized, and last but not least, remember to stop and take a deep breath. I think that might be underrated.
We had to do that at the beginning, yes. Take a deep breath. So what I would like to do now is to have you watch what we call Check It Out. And that segment is going to be with LaRose, who will make you laugh for a few minutes. And then you'll come back and we'll have some closing thoughts.
And rest, renew, revive, relax. That's important for aging, isn't it? It's important for your brain, too. So many people now talk about sleep as if it was a bother. Oh, I don't have time to sleep very much anymore. Have you heard that? I don't have much time anymore. I really don't sleep that much. No, you know, I'm 24/7, 24/7. Well, aren't you an idiot? You don't have to be available 24/7. Your body needs sleep to repair itself. That's when your cells do their best repair work while you're sleeping. Helps your immune response. Helps your memory. People who sleep less have a harder time with memory because your hippocampus needs sleep. Guess what else happens? You can get fatter. People who don't get enough sleep seem to gain more weight more easily. And hey, it's a great way to actually not have to pay attention to a lot of stuff, isn't it? Just lay down. But a lot of people, when they lay down, the roommate starts in. You should have done it tonight before you went to bed. I don't know why you didn't. You should have, you should have. That's called shoulding on yourself.
Welcome back. So what I want to do before we close is to thank my guests, Ian and Linda, for all that useful information. If anyone is interested in more information, even getting more tips on sleeping well at night, because that's an issue I have, please feel free to call us at 617-568-6377. You can also email me at checkingin@ebnhc.org. We would be glad to send you out information in this bag, Checking In with Amy. For this segment, we would send you also a little stress ball, which we could all use at different times, stress ball, and any more information. Just a reminder that we do take care of people who are 55 years of age and older, who live in the catchment area of East Boston, Chelsea, Revere, Winthrop, and Everett. And until we meet again, please take care. Bye now.